Good evening and welcome to this local Outbreak engagement board. For the benefit of the public who might be streaming this or watching later on YouTube, I'm Hal Wollaston, Executive Policy Holder for Public Health and Community Wellbeing, Leisure and Culture at West Berkshire Council and Chair of this meeting. I'm assisted today by James Townsend as clerk for the meeting, by Linda Pye, who is the Zoom host. I will now ask James to display some reminders about how we conduct meetings via Zoom.
In addition to these points, if it becomes necessary for members to telephone into the meeting, you will not be able to signal to speak. So once everyone who has raised a Zoom hand has spoken, the chair will ask anyone who has telephoned in to speak in order. Any voting necessary will be done by a show of physical hands. If we need to adjourn the meeting for any reason, then the chair will advise the board of the revised time and date of the meeting. If it is a short adjournment, you'll be able to rejoin the Zoom meeting. Otherwise, a fresh appointment will be sent. Do members have any questions about the way in which this meeting will be conducted?
Thank you, James. Do we have any apologies?
We have apologies from Councillor Graham Bridgman and Matt Pearce.
Thank you. Minutes of the previous meeting. I've been through and I can't see any errors, but if anyone can spot anything, please let me know. No? Okay. Moving on to declaration of interest. Anybody wish to raise one? In that case, I'll move straight on to item 4, which is community testing update, and Melanie Best.
Hello, good evening, everybody. For those of you who don't know, I've been temporarily seconded to manage the lateral flow testing programme and have a short update for you. I'll take any questions at the end. So our first site was opened last week at Highwood Copse Primary School on the 8th of February up at the Newbury College campus. The first week we undertook 257 tests, all of which were negative, I'm pleased to say. I'm currently awaiting the figures from the fire and police service at the moment, which will contribute to our overall West Berkshire figures, which I will feed into the DHSC on Wednesday. The Newbury Weekly News did a small article that some of you may have seen last week on Thursday's paper, and they will be returning tomorrow to do a piece on some of the staff that are working there, which will again, hopefully will help to raise the profile a little bit. We've got our second site, which opened today at the Thatcham Rugby Club, and we are working on 2 more sites, which will open next Monday, all being well, at Burfield Community Sports Association and the Hungerford Rugby Club. So that will see 4 sites in total for West Berkshire, and bookings for all of these sites will be released later this week, or sorry, for the remaining 2 sites. Our focus has been the government's targeted cohort for key and critical workers, and this has been extended to the fire and police services where they don't have their own testing on site. Most of them do, to be fair, but the non-uniform police in particular have been using the Highwood Copse site, which is good news for us. One of the key cohorts we've been keen to reach are the early years providers, both private childminders and other private nurseries, and we've invited them to attend these sites. And also I hope that we'll be able to reach more of them when we open in Burfield and Hungerford next week. We've been reviewing the opening hours again to try to look at early starts and later finishes to try and pick up as many of those as we can, but we are aware there are still some difficulties around travelling to and from the sites for those that don't drive, and also around their working patterns. Again, we're trying to do what we can to support them. We had a meeting this afternoon around that particular item, and we're going to review what happens after we've opened the next 2 sites, see what the feedback is, and if we do continue to have a problem, we'll look at what else we can do to support them. There are a number of potential solutions to that, but we'll see how that goes in the next couple of weeks. We are continuing to promote the sites through social media, and hopefully the articles in the Newbury Weekly News, like I said, will continue to support that. But I would urge you all, please, to get the message out through your own social media sources to get people through the doors. They can book online. Ideally, we'd like them to book online, just so that we can try and understand a bit more about who's actually attending and where they're coming from. And finally, I'll just touch on the surge testing in the event that we're notified of a positive South African variant in our district. A project cell has been put together and we've already started discussions. A draft plan of action has been drawn up. And over the course of this week, we will be looking to resource that plan and test it out so that we're ready to go in the event that we need to. We also met the comms team this afternoon to talk about that, but I won't spoil Mandeep's thunder because she's got that under her briefing. So I think that's a brief run through. I see Steve's got the question.
If that's okay, Chairman.
Absolutely, Steve. Carry on.
Thank you. Thank you, Melanie. I was going to ask a question later about the South African variant, but you, by your comments, it seems that we don't have any cases of the South African variant at the moment, so that's reassuring. I just wondered, what's the efficacy of the testing at the moment? You know, there was some concerns a few weeks and months ago that the lateral flow was quite a low success. You know, is that better now than it, and higher than it has been?
It is, because it's all done under supervision. So I think when they're done at home, it's very difficult to assess whether or not they've been done properly. But when they're done on these sites, they're supervised by people who've been trained to do it, and they do guide them through it. So I would say I mean, I don't know what the percentage is, but it's very high once it's when it's supervised. So I don't think there are any particular concerns around that.
Okay, and for those people who are watching who've never not kept up, are there plans for additional sites in the more rural districts? Only
the two that I explained, we're going to the east and west. So we've got Burfield and Hungerford, and obviously they are quite they're quite resource hungry to set up. So yeah, we thought hopefully we would get as much as we could with 4 sites. Obviously, if for any particular reason we need to continue the programme, then we'd have to look to extend it, but no plans other than the 4 sites at the moment.
Okay, thanks very much, Melanie.
Okay.
I have a question from Councillor Vickers and Andy Sharp.
Right, thank you, Melanie. Yes, my question is just, I don't think I missed this, but are shop workers being included in the groups that are invited for testing?
We'd like to extend it to so small businesses, because the government scheme which picks up businesses of 50 and over, so the large retailers should be picked up by the government's direct programme, but we are including retail providers in our cohort, and they're welcome to come along.
Are they taking it up? Do you know whether
we haven't done enough? We haven't really had enough to do the analysis, but I do intend to do some analysis on who is coming and where they're coming from the booking system as soon as I get the data.
Thank you very much. Thank you.
Andy.
Thank you, Chairman. Melanie, just a clarification. Am I right in thinking that if people are closer to sites operated in Wokingham and Reading, for example, they're able to utilise those sites as well, just to give some reassurance?
Yes, absolutely. A good point. Sorry, I actually did have it on my briefing and missed it. Yes, so we have had a number of queries from people who are on the outskirts of the district. And what I would say is that it's not specific to West Berkshire. So if you live and work in West Berkshire, but if you live but travel for work, you can access any of the sites on our neighbouring authorities. So please do check their websites out. Reading, Oxford, any of those sites. If you're a key worker, you are welcome to be tested there. And similarly, we've opened our offer to anybody who may live outside the district but work in West Berkshire. They're able to be tested at our sites.
Thank you, Melanie. A very comprehensive report.
Okay.
Going on to item 5, which is Sean Murphy talking about COVID-19 compliance and the role of the marshals.
Thank you, Chairman. I've just got 3 or 4 slides, if I may. Just help me structure through this, if that's okay. Is that visible?
Yep, perfect.
Thank you, Chairman. Yeah, I just really wanted to just recap. So the Council's Public Protection Service have been involved in the enforcement of the business provisions since the very early days, in fact, going back to March last year. And I won't go through all of these, but as you can see, there's been, as many people recall, there have been various stages of unlock and then lockdown restrictions put into place around businesses and events. And we have been involved basically around all of those at every stage of that. So the approach that we've taken is to proactively communicate any of these changes with businesses. So we've run a lot of information through the Council's website, through the Public Protection Zone website. At each stage locally, we've run webinars for businesses, hospitality, close contact businesses, hairdressers and various other businesses. And then we fed out information through our social media feeds, through the Council's social media feeds and through the Council's business bulletins. The messages have actually been aimed not just at businesses, but also at the public. What we've recognised throughout all of this is that there are restrictions on businesses, but businesses can only comply with those restrictions if the public are aware what those restrictions are and what those requirements are. So that our approach to communication has been dual. So we've been helping businesses with the legislation, with the guidance that affects them, but also getting some messages out to the public to enable them basically to access the businesses in a safe manner. Throughout this, we've had a significant number of service requests, both from the public, but also requests for advice from the businesses across West Berkshire. And as at the end of December, we'd had around about 800 since the beginning of the financial year, last April. And these are primarily basically, what do I need to do? Am I able to operate? What do the guidance say about the way that my business is affected? And we've done a lot of work in terms of providing advice to those businesses, but also where we've been requested to do so, also to provide advisory compliance visits. And sometimes those visits have taken place ahead of opening. So for example, with hospitality. We've also had a proactive approach to what we call compliance visits at every legislative change point. So if you go back to the previous slide, so in June last year when we had non-essential retail reopening, then hospitality and the close contact stuff. And then as we moved into Tier 1 in October, national lockdown in November, and then obviously into Tier 2, 3 and 4, in fact, in December, and to where we are now. Most of that work is basically kind of carried out as kind of spot checks, but also the opportunities are taken when we carry out those checks to provide advice to the businesses and to talk through any individual challenges that they're facing. Inevitably, there have been a very small number of enforcement actions, and these are primarily prohibition notices. So they are, in fact, businesses that were perhaps operating outside of the permitted operating hours, or businesses that shouldn't have been operating at all, where we've just served prohibition notices requiring them to stop whatever activity it was that they were doing. A very important part of this, though, is horizon scanning for us. So we're constantly looking at what may be coming up in terms of legislation. Obviously, we've got announcements coming up in the next 7 days or so, setting out potentially some sort of roadmap for where lifting of restrictions will go. And we'll be getting the service into shape for that, basically, and thinking about how, again, we can support businesses and inform the public through that process. Which leads me on to the second part of the presentation, which is around the COVID marshals, because there is an integration between the work of the marshals and the work of the Public Protection Service. So the COVID marshal scheme for West Berkshire launched today. So I can now confirm that we have 6 marshals, COVID marshals, covering the whole district. And that's not just the urban areas, but the rural areas as well. We've identified all of the relevant areas and sites that we can think of at this stage to the marshals, and they've been basically set up on a rota basically to visit those. It's part of the Public Protection Service, and that's an important point really, because this is really an extension of the public protection role of the council, and it integrates directly with the enforcement role of the Public Protection Service, but also, as I'll come on to, obviously with the enforcement role of the police in due course. Melanie has talked about the community testing centres. Each of those that are open currently has a marshal based there as well. And just for point of clarification, they are in addition to the community-based marshals. And when other centres open, they will also be assigned a marshal to assist basically run those centres and integrate with the public as they arrive. The service covers 7 days a week. Obviously on a rota, and what we try to, and at the moment basically we'll operate normal daytime hours, but we have basically set it up so that when we get to the point where restrictions are eased and lifted in due course, for example with the nighttime economy maybe starting to reopen, that the hours of the marshals will change to assist with the reopening process for businesses and also basically to assist with the public. The initial period is for 3 months from today, but obviously we'll see how that goes and how that fits in with the kind of changing national and local landscape. The brief they've been given really is high streets, but also public spaces, parks, the public spaces such as the commons. We've identified set event days in a sense, so things like markets. So we know that on certain days certain markets take place. And they've been asked to basically kind of prioritise things like that, but also things like out of town shopping areas and the like supermarkets and the like. The role really, I just wanted to spell out, if I may, really it is to support the community. So it's things like promoting social distancing, face coverings, helping with queues outside premises, integrating, assisting, talking to the public, talking to businesses. And also basically to focus that really at local levels. So one of the things that we have done is we've been in contact with the towns and parishes. We've been in contact with local ward members to ask if there are any areas that they would like to see the marshal service concentrate on, or any areas that they would like to visit. They will have a visible presence, as I say, across the district. They are identified as West Berkshire marshals with West Berkshire kind of identifiable kind of uniforms on. I just want to be clear that they have no enforcement powers, and I think that's an important point really, because it is that role about engaging the public on a different level to for example the police, who obviously have an engagement with the public on an enforcement basis, and the Public Protection Service have an engagement with businesses on a enforcement basis as well. Of course, we all do more informal engagements, but the marshals have no enforcement powers. And primarily their role is to pick up issues that are not enforcement issues. So there are a large number of those that basically come into both ourselves and to the police, where people raise concerns about specific areas, issues such as social distancing and things like that, which aren't necessarily primarily enforcement issues. But they will, however, work closely with those responsible for enforcement. So we've been in contact with our colleagues from Thames Valley Police, and we will be seeing this as a route basically to refer matters to where aren't, strictly speaking, enforcement matters. Just a word about timing. So one of the reasons, obviously, we brought them in at this point is that we are looking ahead again, talking about to this issue of horizon scanning, that we see basically them providing a vital role when it comes to assisting with the easing of lockdown restrictions, and the way that then they'll be able to work with both the community, but also with the towns and parishes, but also ourselves as business enforcers, and with the police as enforcement of the public related matters. So that's really just a bit of a brief overview of where we've got to. As I say, they have launched today. People should see them out there in the communities. We've identified all areas of West Berkshire that we want them to visit. We'll be constantly adjusting that as information comes into us. I would urge the public and businesses to engage with them. Thank you, Chairman.
Well, just out of curiosity, where do we recruit these marshals from?
We've engaged a company to supply them to us, Chairman.
I've got a question from Councillor Doherty.
Thank you for your presentation, Sean, and actually thank you and the team for all you've done as the Public Protection Partnership, because I know you've been working tirelessly throughout this pandemic. I suppose there's two questions following on from Councillor Wollaston's. CV almost of the company that we've employed them from, because obviously I know the background to that, but perhaps share a little bit of the experience that they have in Berkshire with us to reassure our residents. And also it's really good that you talk about the fact that they have no enforcement powers, because their role is really that of engaging and encouraging our residents. And I guess the question that comes up most, and you've partially answered it already, but perhaps a little bit more detail, is why now? Obviously, we got COVID Marshall funding, which was a direct grant from central government. So it's that money that's been allocated for this scheme. But we've had the option to use that earlier. But why now? I just, from your point of view, because I know it's a question that most people are tending to ask.
Thank you, Leader. So picking up those points in order. So the company that we've engaged to provide the marshals are in fact actually providing marshal services all over the country, and in Berkshire actually providing a marshal service in at least 2 other authorities. So they are experienced in this area. They've learned a lot, in the conversations I've had with them, basically about how you provide these services. And so that's the basis on which basically we brought them in. They're very experienced. They know who they're looking for in terms of selection. We've made it stress that we wanted people as far as possible with local knowledge. That's very, very important. Going on to the role in terms of enforcement, you're quite right. I mean, I see them very much as, if you look at the whole debate about enforce, engage, explain, these are very much the engage and explain element of that. And the enforcement bit, the last bit, basically belongs to the relevant authorities for doing that. Why now is a good question, and it's obviously a question that we have been asked. When we concentrated at the time when the enforcement marshal scheme was first developed, a lot of the emphasis was around businesses. A lot of the businesses were open, and at that time, basically, we felt that that our efforts were best placed, basically working with those businesses, reaching out to the public in terms of communication, but effectively working with businesses to operate in a safe as possible manner, in accordance with the law, in accordance with the prevailing guidance. But we see the timing very much as the right time, if that's the way to put it, in the sense that, sometime in the next few weeks, few months, hopefully restrictions will start to ease. And we do see that basically the timing of bringing them at this point will help a lot with that. So as we can step up patrols, as non-essential retail potentially reopens, as hospitality potentially reopens, as other venues reopen, whatever restrictions, subject to whatever restrictions they are. So it just feels that the timing is right, and the period of time that we're looking at initially, this 3 months, also feels like the right period. We won't know for certain what that roadmap or the indicative roadmap will look like until perhaps next Monday, when we get a greater idea. But we've seen some of the kind of reports about possible roadmaps in the last few days, obviously. So that's really the basis of it. We have engaged with them basically the last couple of weeks, certainly with the company, to make sure that effectively their role is clear in terms of West Berkshire, that what matters to West Berkshire as a community is clear. And we've made it very clear as well that we don't want this to be basically a town centre centric service, that this is basically a service for the whole community.
Thank you, Sean.
Councillor Vickers.
Thank you. Thank you, Chair. Thank you, Sean, for the presentation. Yes, I would have thought this is a good time to have the marshals. I'm seeing myself, right, the weather's been dreadful, but it's beginning to improve. And as spring comes and as people have had their first jabs, I think I'm already feeling this, that people are beginning to feel a little bit more, optimistic, confident, things are relaxing a little bit. So I think the COVID marshals will remind people that we're not quite there yet. And also I think there's a sort of reassurance about having people who are visibly there to talk to if you've got concerns, or to, rather than as an individual, you feeling you've got to sort of remind somebody that they're not behaving correctly or something, you'll know you've got the marshal. So I think it is good. Do they have powers? Are they going to go into businesses and keeping an eye on how businesses are operating, or are they purely sort of in the public spaces? That was one question. And also, you said you're approaching councillors to ask for their suggestions about where they might focus. I haven't been approached yet. Should I have been approached? I represent Newbury Central, which I thought was quite a sort of place where, you know, you might be wanting to get some guidance or something. Is that about to happen? Because I'm not aware of being approached yet.
I will. I can talk to you separately, Councillor Vickers. We did actually send a note out to all members. It was a very brief note in the kind of early days, yeah, about a week or two back. And we did get one or two. We did get one or two responses back, as we've had a number of responses back from the parishes that we approached last week. But we are. I mean, effectively, the members, the parishes. Others basically are what we really need is the information. We don't want people basically, we want these people's time to be used effectively, and part of that is going to the right places at the right time. So we very much hope that obviously people will engage with us. In terms of the timing, I absolutely agree. You know, I mean we've talked a bit about this. We've talked quite a lot about this actually over the last few weeks and months. And it just really does feel that effectively, for many of the reasons that you've given, that the time is right for this. That basically there is a kind of there is a combination of kind of optimism and change potentially in the air, and of course that will develop as the announcements kind of come out next week, and we start to see basically some sort of roadmap. So you know, we do feel the timing is right, and hopefully there'll be a valuable contribution to that whole process. Thank you.
Thank you, Sean. I can't see any more questions, so we'll move on, if we may, to the next item, which is situational report and incidents, which April is going to deal with tonight.
Thank you. I'll just share my screen. Okay, can everybody see that?
Yep.
Okay. So just to give you an overview, of where we are. So it's quite good news that over the last week, case rates of COVID-19 to continue to decrease in all Berkshire local authorities. So far, there have been 5,834 cases of COVID in West Berkshire since the start of the pandemic, and 213 of these have been in the last week. The rate per 100,000 has decreased and now stands at 134.4, and the positivity rate has dropped to 5.9%. Just to say that this presentation doesn't take into account the most recent data that's been published today, but just I did look up the most recent rate, and it is, for us, it's 124.3 per 100,000. So you can see from the table here that if you look at the, you can see West Berkshire, and we're highlighted slightly in yellow, and you can see that our rate for the over 60s per 100,000 has also dropped, and that's at 62.2. So this just gives you a map of across different local authorities, where you can see the darker the shade, the higher the number of cases. So the next slide looks at the epicurves of each of the local authorities. And there's been a total of 51,428 confirmed cases of COVID-19 in Berkshire. 72% of those cases have occurred since the beginning of December 20. So hopefully you can see that all the curves. So West Berkshire, we're down at the bottom on the left-hand side. You can see that actually our cases didn't rise as high as some of the other local authorities, but all local authorities you can see are all on a downward trend. The next map looks at, we call it a heat map, and we look at the weekly rates by age group in West Berkshire. And this data is from the 21st of January to the 4th of February. So weekly rate information is now available by 5-year age band. This heat map enables us to see levels of COVID-19 diagnosis by age group and how this has changed over time. So the darker the colours, the higher the weekly case rates per 100,000 per population. So you can see, if you look at on the left-hand side of the graph, you can see its age group. And at the bottom, you can see it's over time. So weekly case rates at the 4th of February show the highest rates in people aged 30 to 34 and the 20 to 24 year age groups. As we can see, case rates have decreased in most age groups over the last week. Next slide is about deaths. Very sadly, in West Berkshire, there have been 209 COVID-related deaths since the start of the whole pandemic. 111 of these were in hospital and 83 were in a care home. In the last week, with the data reported from the 23rd to 29th of January, again, very sadly, there were 14 COVID-related deaths. Since March 20, and I know Matt's spoken about this to you before, West Berkshire's all-case mortality rate is 20% higher than the previous 5-year average, which equates to about an additional 216 deaths. Hospital activity. So the number of admissions for COVID-19 patients is starting to slowly decrease in the Royal Berkshire Foundation Trust hospitals. There were 11 admissions on the 31st of January. On the 2nd of February, 201 patients were in the hospital for COVID-19, and 28 of these were on mechanical ventilations, which is good, again, that we can see that the activity is starting to come down. But just a reminder to everybody that we still need to be absolutely vigilant. Even though our cases are coming down, we need to be really clear that we are still sticking to that national guidance to make sure that we keep bringing our case rates down, and so that less people are obviously being admitted to hospital. The next slide looks at ward data. So you can see some of this data has been rounded up because it's based on small numbers. You can see by ward to the left-hand side of the slide, you can see the number of actual cases per ward. And next to that in blue, you can see the rate. And then the orange parts of the graph refer to the total numbers since March 20 and the rate per 100,000 since March. So you can see some of the wards have slightly higher number of cases than others. So that you can just basically see some of those areas where we've got higher cases have kind of been the same for a little while now. So outbreaks, the next slide is obviously looking at the outbreaks. Over the last 14 days, PHE has informed us of 29 residential COVID-19 outbreaks, and 5 of those occurred in West Berkshire. This again is showing us that most of our cases are in residential dwellings. So 88% of our cases are in residential dwellings and 3% in care homes. So in summary, the confirmed COVID-19 case rates have decreased in all Berkshire local authorities over the last week. There have been 5,834 cases of COVID in West Berkshire since the start of the pandemic, and 213 of these have been in the last week. The rate per 100,000 has decreased and now stands at 134.4, and the positivity rate has also dropped. West Berkshire's rate for people aged over 60 has also decreased by 42% in the last week to 62.2 per 100,000. As just mentioned, the hospital admissions for COVID-19 is slowly decreasing in Royal Berkshire NHS Foundation Trust hospitals. And sadly, as I mentioned, there were 14 deaths from COVID in the last week. So just to remind everybody, we all have our role to play, and although there is a positive picture, a more positive picture, our case rates are still high. So we need to remember those, to follow the national guidance, and to remember hands, face and space. So to wash our hands for 20 seconds, to remember to wear face coverings when we're in closed spaces, and at all times to try and keep 2 meters away from people that we don't live with. There's a further, just a little reminder about testing and self-isolating. If somebody has symptoms, they should isolate and book a test. And while they're waiting for their test, they need to isolate as well until they get their test results. And if their test results are positive, they need to continue to isolate in line with guidance. There's lots more information if people are interested on the Berkshire Public Health websites. You can go on there and see lots more data information for the areas within Berkshire. And just one other thing that I wanted to flag was about the new vaccination webpage. So this webpage tells you lots of information about the vaccines, questions and answers. There's some videos as well that people can have a look at. And there's a really good section on facts and fiction about the vaccines. So that's a really good thing for people to go and visit and have a look at, because they might have some questions about the vaccines or things that they're not sure about. So everything's there. So I really recommend that people have a look at that. And that just concludes my presentation. Thank you.
Thank you, April. Could I kick this off? Because by coincidence, I got my letter from the NHS this morning. And I think a lot of people are probably slightly confused whether they should respond to that letter or wait to hear from their local surgery.
Was that in relation to the vaccination?
Vaccination, yeah.
Yes, so there's been a slight change, I believe, in the process, and that if people are offered the mass vaccination sites, that's where they can book their tests if they're in the next cohort. If they are in the age group from 16 up to 64, where they have got underlying health conditions more vulnerable, those cases can be vaccinated at the racecourse. I believe that's the latest information, because I think before we were saying to people that if they received a letter offering them the mass vaccination site, they could wait if they wanted to have their vaccination at the racecourse. But that has slightly changed, I believe, in the last couple of days. Meriden, you might have something to say on that.
Yes, the reason they're doing that, Councillor Wollaston, is because the largest group is the people with long-term conditions. And the only people that can really identify them properly is through general practice, through their registers. And so what they'd like is for primary care networks to really focus on the people with long-term conditions. And so for the people over 65 and then over 60s, they'll be invited to the bigger centres. But there's no reason why people can't go to the PCN and to the local GP if that's who's offering it.
Okay, thank you. I've got Councillor Vickers.
Thank you. I have got a question, but just to share my own experience, I've had my jab in the last week, and what happened with myself, I got a letter inviting me to go to Basingstoke or make an appointment there, and then but the letter said you can wait to hear from your GP, i.e. to get an appointment from the racecourse. So we waited a few days and nothing happened, and then we went back to book, and then there was another appointment for somewhere in Reading. So we were about to book. I think we did book for a pharmacy in Reading, thinking we better not wait any longer. And then the same day we were contacted by phone from our own GP practice and given an appointment at the racecourse. So it's a little bit, obviously we'd all prefer to go nearer home and not have to travel. But it seems to be they're both working parallel, and you can almost choose to respond to one or the other. But obviously you then go and cancel the appointment that you've made. So that was our experience, and that's been the experience of my neighbour and of other people I've talked to, that they get the mass vaccination one, the NHS appointment, and then just a few days later, they're contacted by their surgery, which is usually a text or a phone call. So you need to be keeping a lookout for that. So I'm just sharing my experience. My question was going to be, there has been about the groups that are being contacted at this moment, because we're down to the sort of, 65 or 60 plus, and people with underlying conditions, I think, which I think is what you just said, April. But there are some people, there's been a bit of publicity in the media about people who aren't being called, but feel that they have conditions that should be considered for priority for vaccination. And I believe if people do think that, they can contact their GP, and their GP can judge whether or not they should be included as a priority group, because some people have sort of conditions that aren't probably so well known. They're a little, so they need to talk to their own GP, who then gives them advice. I don't know whether yourself or Meriden has any comments on that.
It may well take a month or so for GPs to get through all the people with underlying conditions. It is the largest group. So not everyone will be called straight away. So I think that the 65 to 70s is a much smaller group. So that's why they're being contacted a lot sooner. So it is going to take some time to get through all of those people with long-term conditions. What the GPs will do is they'll gradually go through all their records, and they bit by bit, and they've been given some help. There's going to be a tool to help them to prioritise to do that. That'll be coming out either this week or next week.
Thank you very much. That's useful.
Councillor Doherty.
Thank you. My question probably crosses between April and Mandip, who's about to give a communication update. Based on what Meriden's just said, and I had a meeting with CCG earlier, so Sharose, you might have a view on this as well. It is quite a different message to what we currently have on our website, and it's a different message to what we have on the FAQs with regards to the vaccine pages that you just put up about April, because previously we've been telling people to wait for their GP if they didn't want to go to the mass vaccine site, and certainly for the over 70s, that was the message that we've been pushing out. However, I understand now that the racecourse will be prioritising those in phase 6, which is the underlying health conditions, whereas the mass vaccinations will be done simultaneously, doing a phase 5, so the 65 pluses. Just how we're going to, obviously we're all sat in this room hearing this tonight, but how we're going to make sure that's communicated out, because throughout this process, this has been the question that's asked most around, well, Martha's just shared her experience, but there's many residents have come through and had the same experience. They've had a letter. We've been telling them at this local outbreak engagement board that they can wait until their GP contacts them rather than using the mass vaccination site. That message is now slightly changed. So really interested in how we communicate that now to residents and how we ensure as wide as possible so that we don't, we don't cause any more confusion. I understand why it's being done. It's for me, it's how we actually get that message out to residents, because I know Sir Simon Stevens was actually on the briefing this evening, the Down the Street briefing, saying exactly the same thing as you've said, Meriden, but it is a different message. And I just think we need to be really clear on how we communicate that to the residents of West Berkshire to prevent any confusion. I'm guessing Mandip might be picking this up, but I sort of, it felt between April and Mandip, so just throwing it in there.
I mean, there is one message all the same, is wait to be contacted. People don't really need to contact the GP or anyone else. They will be contacted. And so I think that message is still the same, but I think these lists that are going out to people, there isn't actually prior warning. No one gets a list of them. We don't actually know that the NHS is sending them out. So that's a slightly difficult one there. There's these national letters going out. No one gets prior notice. So we're sort of doing this a little bit behind, it's the horse behind the cart really, in a way. So, but I think maybe it would be useful to put something out to the public saying you may get a letter nationally, or you might get one from your GP. If concerned, your GP will contact you anyway. So that's about the only thing. But I think what GPs don't need is lots of people contacting them at the moment. They are ringing lots of people, but they don't really want lots of people ringing. So it's not an easy message to do it. Maybe Mandip can.
It needs to be a consistent message, Meriden, because already the things you're saying are slightly different to the things we've been saying. So that's what I'm saying. I just think we need a consistent, clear message, which is easy to understand, going out to all of our residents.
Councillor Burke.
Thank you, Chairman. Yes, a few weeks ago, about 3 weeks ago or so, I had a letter from the NHS saying that I was going to be invited to a testing centre that might be further afield, or I could wait. At that time, there were few centres, so I was expecting to be asked to go a considerable distance. So I can imagine that other people receiving a similar letter, when they subsequently had their NHS letter inviting them to book, which I did on Saturday, they may well be, thinking, oh well, I might as well just wait. I don't want to go miles and miles and miles. When I logged in, and I was offered an appointment at Basingstoke, 8 miles away, I could have gone yesterday. It's absolutely brilliant.
Can't see any more hands up. But Sean did actually send me a message saying that he missed answering one question on whether the marshal would be going into stores or not.
Thank you, Chairman. Yes, sorry, Councillor Vickers, I realised as soon as I stopped talking that I didn't answer that question. Basically the answer to that is that we're, obviously, as we've already said, that they won't have any powers, but we do really hope that obviously in their kind of capacity as marshals that they will engage with businesses, and if businesses are consensual, then obviously of that situation that they will be able to go into stores. I mean, supermarkets is one of the areas at the moment where we are receiving concerns, and so a visible presence if the supermarkets are comfortable with that basically would be something that we would encourage.
Thank you, Sean. Thank you.
Can we then move on to the communication update from Mandy?
Yes, good evening. I'll be able to come back to some of the points that were also raised in this meeting earlier, but just an update from me. So we are continuing with the national messages of lockdown. I know it's probably been the same for quite a number of weeks yet, but it's still useful to keep reiterating those same messages through our comms channels and through our community conversations as well that we are having. An update on lateral flow tests that Melanie did also give earlier, but we have got a web page set up for residents about lateral flow tests, and also one for businesses as well. And just in case somebody wants to go and visit and have a read, the web address is westberks.gov.uk/coronavirus, and from there's links to all of the other areas. And so information about the LFTs has already gone out to the media, to our residents via the bulletin, social media, and we are also arranging a video to be made for businesses with 50+ employees, urging them to get the test kits from the government. In regards to vaccinations, again, we are kind of supporting the messaging that's coming from our NHS colleagues on this, and putting as much information as we can out to residents and to businesses. We've also got a dedicated web page on our website about vaccinations, which is updated as kind of as much as we can, also with a link on there to the Berkshire Public Health site as well. I've already had a conversation with Joe at the Berkshire West CCG about the new messaging that needs to go out. So we have just been having a bit of an email conversation about that, and we can obviously do some promo on that and put that out everywhere. COVID marshals, again, we've been working on some pieces for that, and we're looking to do a photo shoot and do kind of a day in the life of a COVID marshal, and do a video as well about that. Again, just reiterating what Sean said, which was that it's about engaging with the public and businesses to kind of stay safe and keep up to date with the restrictions and changes over time. We are also sharing the video stories that have been produced by Public Health Berkshire, and these feature leaders from within the community and talk about kind of the restrictions and sticking to the rules. So we've been sharing that far and wide as well. And then coming up, we're in the process of, as Melanie mentioned earlier, about putting together some comms for the surge testing, should the new variant be detected within our district. And finally, we are waiting for the announcement that's going to happen next week with any of the changes that happen to the restrictions, but also just to point out that we don't hear about it any earlier, if in case people think that we hear about it at the time that the Prime Minister talks about it. So we do try really quickly to try and make sure that we are up to date with some of the key messages that we can put out quickly, but we do try and make sure that we can get some of the information explained a bit more, because we know that residents always have a lot of questions. So we will try to put the key messages out that we can, and then we always follow up later on with much more detailed information as we go. But if anybody's watching and hasn't signed up to receive our residents newsletter, which we send out weekly, I would encourage you to sign up to that, because that's always full of loads of information that's really, really helpful. And again, just go to the website. There's a red banner that talks about coronavirus, takes everybody directly there, and you can sign up via that. And that concludes my comms update.
Thank you, Bandit. I can't see any hands up there. So moving on to future meeting agenda items. I actually found that sort of the guest appearances we've had over the last 3 or 4 of these boards quite interesting and useful. So any suggestions for any other that we could possibly ask would be much appreciated. Perhaps straight to James, and we'll see what we can sort out for 2 weeks' time.
Oh.
So I've got a chat here from Shiraz. Do you want to add to that, Shiraz?
No, it's just to let you know, I've emailed our vaccination lead just to confirm about the communication. So I know Mandip's linking in with Joe, but I'm just checking because I know a lot of the communications have been controlled nationally. So I'm just making sure what's coming through, and I can email that to James to send to everybody to provide that assurance.
Right, I have Councillor Doherty.
No, I was just going to make a suggestion, because obviously the fortnightly timetable of this meeting, the next one will be prior to hopefully the schools reopening on the 8th of March. And I wondered if we could get a primary school teacher to come in and talk to us about the plans that are in place. We had a secondary school teacher last time, and that was really useful. And I think with the reopening of schools, it'd be really good to hear direct from our head teachers as to what that means to them.
Donny, can I possibly leave that with you to think about who might be appropriate?
Yes, you can, Chairman.
Thank you. Councillor Masters.
Thank you, Chairman. Just for Mandeep and for the wider group, to be honest, with the slight confusion over the communications for call up for vaccinations, are there any plans to hit social media, particularly Facebook, which most, many of the people who are online, is there any plans to hit the whole of the district with paid for Facebook communications to once we've got the messaging right?
Is this specifically for vaccinations or just?
Yeah, well, no, especially because of we've a number of people have raised the issues of slight, the need for clarity over the messaging. It takes time to get people's attention. Some of these briefings that are on YouTube are not particularly well watched in terms of numbers. So just I just wondered whether there was any budget or plans to do that to make sure that we allay the public fears.
Yeah, certainly something that's on our radar and on the list to look at. But again, in the sense of vaccinations, because we're not administering it, so we are kind of working with the NHS on that one. But kind of messages that are going out, then yes, we're more than happy to kind of look into that a bit more to make sure it's spread far and wide.
Thank you.
Not see any more hands up. Any other business, anybody? In that case, I think that concludes the meeting. Can I ask panelists to remain in the virtual meeting room and not leave until the host has confirmed that the meeting is no longer being streamed? Thank you everyone for attending, and particularly members of the public.